హలో. హలో. చెప్పండి. ఓకే. ఐప్యాడ్లో వీడియో ఆడియో ఆఫ్ చేశాను. ఇక్కడ పక్కన ల్యాప్టాప్లో ఆడియో ఒకటి ఆన్ చేశాను. వీడియో కూడా ఆన్ చేయాలి కదా? ఓకే, ఇప్పుడు కెమెరా కనెక్ట్ అయ్యి ఉంది, బట్ నేను కనబడతానా? ఆన్ చేయాలి ఖచ్చితంగా. ఓకే, ఆన్ చేశాను. స్టూడెంట్స్ జాయిన్ అయిపోయారా? జాయిన్ అవ్వలేదు. ఓకే, ఫైన్ ఫైన్. ఓకే ఓకే, థ్యాంక్ యూ. ఓకే. Hello guys, how are you all? Good evening, Piyush. Good evening. Good evening, everyone. Guys, how are you all? Everyone is doing great. Tushar, good evening. Sonu Kumar, good evening. पीडीएफ मैंने कल ऑलरेडी ग्रुप में भेज दिया, ठीक है। सो आप एक बार देख लेना पीडीएफ को। तो मैं अपना टेलीग्राम, व्हाट द टेलीग्राम, आई सेंड यू माय टेलीग्राम link, okay? So you can join in that, and there you will have all these important things, okay? Clear? Okay, so I'll send you the telegram group right now so that you can have all these important things over here. So all of you, I'll share it right now. So कैसे share करूँ इसको? Right. So in the chat box itself, I'll share it to you guys, okay? I'm fine, thank you so much. So all of you just look here in the chat box itself, I'm sharing it to you. This is my official Telegram page over here. So here you can find all the notes, not only the notes, even you can find everything over here, okay? You can find the notes, you can find the MCQs, daily discussions and all, everything you'll find it here. Even after today's class, I'll post the notes here itself, okay? So here itself, I'll post the notes. So all of you, hope all of you are clear with this, yes or no? You got the, so this is the link, which I have already kept it here, okay? Link is not showing. Okay, guys, or else do this thing. I'm going to type one thing, just type that thing. Okay, fine. So what I'll do is that I'll send it to you immediately after the class, okay? After the class, I'll send it to you. So guys who have already joined the group, okay? Whoever has already joined the group, what you do is that you share this link with your friends, okay? So that would be fine. Right. So guys, yesterday's class, I hope all of you understood yesterday's class. Everyone is cool with yesterday's class. You have revised the things yesterday. Yes or no? Yeah. Afshan Ansari, good evening. So yesterday's class, my video, am I audible to you? Am I audible to you? And second thing, can you look at me? All of you, can you look at my video? I'm not visible, right? I'm not visible, but I'm audible to you. Fine, fine. Am I visible now? Right. So let us not waste the time, guys. So yesterday we have discussed about these things, right? So we have discussed about Bacillus anthracis, we have discussed about Bacillus cereus, we have discussed about Clostridium botulinum, and I told you one very important thing. मैंने notes send किया था, all of you, and that's what I'm telling you. So those who have already joined my Telegram group, there you have the notes, okay? So those who haven't joined the Telegram group, I'll send you the link, or you can ask from your friends and then you can join it. Okay. So yesterday we have discussed this important thing. We discussed one very important thing, that there are only two species which release spores. What are those two species? Answer very fastly, very fastly. We have to move on to the next topic. What are the only two species that release spores? Very good. Bacillus, very good. Very good. Fatima, very good. Vaishnavi, very good. Everyone, very good. Very good, Lokesh. So there are only two species that I told you. One is called as Bacillus and the other one is called as your Clostridium. These are the two species which release the spores. Okay, so these are the two species which release the spores. We have also discussed what are the important conditions that are caused by all of this. This is a very important question. Okay, so from here, definitely in your FMG exams, definitely a question will be asked from this part. Okay, so from this part, definitely the questions will be asked. This one. From this entire part, definitely the questions will be asked. Definitely one question is for sure. Okay, so keep this thing in mind over here. Okay, now what we shall do is that we shall go on to the next important thing. What is the next important thing over here is that, right. So I hope I've already told you that what kind of gangrene is this, guys? Anyone? What kind of gangrene is this over here? This kind of gangrene which you can see over here is called as your gas gangrene, right? So this is your gas gangrene. So this particular gangrene over here is called as your gas gangrene. I will look at your chats in a minute. Okay, I'll look at your chats in a minute. Yes, it is gas gangrene, but initially it is wet gangrene over here. Later on, it turned to the gas gangrene. Fine. Chalo. So now what we have to discuss is the most important thing, guys. I want all of you to be attentive over here. Agar notes bhi nahi likh rahe, then it is fine. Nothing is going to happen. Yeah, fine. So the important thing which you need to know over here is that, first of all, the entire microbiology is completely based on gram-positive bacteria, gram-negative bacteria. Okay? Gram-positive as well as gram-negative bacteria. Now, what do you mean by gram-positive bacteria? What do you mean by gram-negative bacteria? This is a very important thing that you have to know. Okay? So here I have drawn two separate images. Okay? So in one image, I'm telling it is gram-positive and the other one I'm telling it is gram-negative. So what is this gram-positive and gram-negative? This classification is mainly based upon the cell wall. Okay? This classification is mainly based upon the cell wall. So based upon the cell wall, you classify it into gram positive and gram negative. Now what I'm telling you is that, let me highlight one very important thing. Okay, let me highlight one very important thing over here. Can you look at this yellow color shade which I'm giving over here? Right. So this yellow color shade is nothing but called as your peptidoglycan. What is this called? This is called as your peptidoglycan. Okay. In the same way, you even have got that same yellow color layer on the other side. This is also called as peptidoglycan. So how many peptidoglycans over here we are discussing? So this is called as peptidoglycan, and this is also called as peptidoglycan. Now listen very carefully. I know you know this thing, but still I want you to listen because I'm going to develop one very important clinical point over here. Now, tell me, one peptidoglycan layer is very thick, one peptidoglycan layer is very thin. So, if there is a thick peptidoglycan layer, it means it is a gram-positive bacteria. If you see a thin peptidoglycan layer, it means it is a gram-negative bacteria. So, from now, keep this thing in mind. Gram-positive bacteria will have a thick peptidoglycan layer. Gram-negative bacteria is going to have thin peptidoglycan layer. Okay. So, this is called as gram-positive and this is called as gram-negative bacteria. Till here you are clear, right? Now, what are the things that are located below this? What are the things that are located? Below this peptidoglycan layer, you see phospholipid bilayer. From your 10th standard onwards, you are keeping on studying that there is something called as phospholipid bilayer. This is also called as cell membrane, or you can also call it as plasma membrane, right? So you have studied that phospholipid bilayer is what? Cell membrane or plasma membrane is having your phospholipid bilayer. So you can see this, that this is a bilayer, 2 layers. So this phospholipid bilayer is nothing but called as your plasma membrane or your cell membrane. Okay. So can I tell these two things over here are plasma membrane or cell membrane, PMCM, plasma membrane or cell membrane? But gram-negative bacteria, look at gram-negative bacteria. In gram-negative bacteria, above the peptidoglycan layer, there is another phospholipid bilayer, right? So this phospholipid bilayer, which is located above the peptidoglycan layer, is called outer membrane. What is it called? It is simply called as outer membrane. So, is outer membrane present or absent in gram-positive bacteria? It is absent in gram-positive bacteria and it is present in gram-negative bacteria. Second difference, gram-positive thick peptidoglycan, gram-negative thin peptidoglycan layer. Okay, so these are the things you need to know. Now, what is the clinical point? You told me that you will tell me one clinical point over here. What is the clinical point? What I'm telling you right now is that between the outer membrane, see, this is outer membrane and this is the plasma membrane. Outer membrane or plasma membrane के बीच में, between outer membrane and plasma membrane, whatever layer you have got, right? That is called as periplasmic region. What is periplasmic region? Periplasmic region is the space that is present between outer membrane and plasma membrane in case of gram-negative bacteria. Okay. So this area you call it as periplasmic region. So what is this area you call it as? You call this area as periplasmic region. So what is the importance of periplasmic region? Everyone, don't write anything. Just listen to what I'm telling right now. Okay. What is the importance of periplasmic region is that this particular periplasmic region is having an enzyme called as beta-lactamase. Okay. What is the enzyme that is present? Beta-lactamase. Now listen with both of your ears. For example, I got gram-negative bacteria infection. Okay. If I get gram-negative bacteria infection, for example, you have given me penicillin. Okay. Or let us say penicillin is not available. You have given me cephalosporin. What are the two drugs? Either you give me penicillin, or you give me cephalosporin. Now, even, penicillin is a powerful antibiotic. You know that cephalosporins are also powerful antibiotics. So when you give penicillins and cephalosporins, right, for a gram-negative bacteria infected patients, these penicillins and cephalosporins will not work. Why these penicillins and cephalosporins are inactive or ineffective in case of gram-negative infections? Who will tell me? I hope you understood my question, right? Why penicillins and cephalosporins are ineffective in case of gram-negative infections? Not extra lysis. Very good, Muntazir. Muntazir is right. Very good. Very good. Nadeem Alam, perfect answer. So why penicillins and cephalosporins are ineffective is in the sense, the first important thing you need to know, ये देखो, बीटा लैक्टमेज क्या होता है? बीटा लैक्टमेज is nothing but beta lactam ring. Obviously, A is in the sense it is an enzyme. So penicillins and cephalosporins, when you look at the structure of penicillins and cephalosporins, they have a ring. I'm just drawing a rough ring, okay? They have a ring. Such ring is called as beta lactam ring. Beta lactam ring. Now, can I tell penicillin and cephalosporin is a beta-lactam ring antibiotic, beta-lactam antibiotic? So when I am taking that antibiotic, I'm taking penicillin right now. So what is happening? Within the periplasmic region, there is beta-lactamase already. This beta-lactamase will destroy the beta-lactam ring. In the same way as protease will destroy proteins, lipase will destroy lipids, amylase will destroy what? Carbohydrates. In the same way, beta-lactamase will destroy beta-lactam ring. So beta-lactam ring agar destroy hua, then do you think penicillins and cephalosporins will work? They will not work. That is the reason why they are ineffective. Okay. So beta-lactamase breaks down or it would cause lysis of this ring. Okay. So what should you do? What doctors thought is that if these antibiotics are not working, what is the main problem? The main problem is beta-lactamase. If beta-lactamase is not there, everything, the root is cleared, right? So what doctors did is that they thought that we will first target beta-lactamase enzyme. पहले उसको खत्म करेंगे, beta-lactamase enzyme को खत्म करेंगे पहले, right? So then they started discovering new drugs. These drugs are called as beta-lactamase inhibitors. So first you inhibit the beta-lactamase enzyme, then you enter into the bacteria and kill down the bacteria. This is the complete plan. Okay. So there comes these drugs. These drugs are called as beta-lactamase inhibitors. Beta-lactamase inhibitors. What are the beta-lactamase inhibitors? I'm just writing it because I told you I will teach everything clinical. So I'm just writing down the names of the drugs. If you want to remember it, or else you'll study in pharma. So one is already you're answering here, Muntazir, very good. Sulbactam, Tazobactam, and clavulanate. Sulbactam, Tazobactam, and clavulanate. These are beta-lactamase inhibitors. So these are effective in gram-negative infections. I hope all of you are clear with whatever explanation I have given it to you. Is everyone clear with this, guys? Everyone, if you are clear, then I'll go to the next. Tushar, you are clear. Only few students are answering. What about 132 students? They are not at all answering. So remaining are introverts. That is why you're not answering. Right. So anyways, another important thing I want to tell to you over here. What is this important thing over here? Right. Now, all of you just look at this important thing. So, but this is your peptidoglycan. This is your peptidoglycan. This is your peptidoglycan. Now tell me, anyone tell me this is gram positive or gram negative? Gram positive or gram negative में क्या फर्क है? What is the difference between gram positive and gram negative? And tell me what is this? Very good. Very, very good. This is gram negative because how did you tell? Because one is it is having thin peptidoglycan layer and second is it is having this outer membrane. Okay. By these two ways you told it is gram negative bacteria. Now, what I'm telling you is that to this gram negative bacteria, there are some structures which are located above the outer membrane. What are these structures? These are very important. Just pay attention. Don't write anything. I will tell you where to write those things. So first important thing is that you see small snake-like processes on the top of the outer membrane. These snake-like structures which I'm drawing right now, these are called as lipid A. Lipid A is a very, very dangerous component. Okay? Right. After lipid A, above this, there are some more structures like this. You see? So these structures which I'm drawing here right now, right? So these structures which I'm drawing here right now, these are nothing but called as your core polysaccharide. What is this called? This is called as your core polysaccharide. Core polysaccharide. Okay. Above the core polysaccharide, you have got some structures in the form of O. O stands for what antigen? O stands for O antigen. Okay. O stands for O antigen. So if I ask you what are the layers that are located above the outer membrane, one is lipid A, uske upar core polysaccharide, and above that you have got O antigen. So all these layers together you call it as lipopolysaccharide. Lipopolysaccharide. Lipo in the sense lipid A, polysaccharide is polysaccharide, lipopolysaccharide. Okay. Now, why did I tell you this? Why did I tell you this is that out of all these layers, ye dekho lipid A hai na? I told you lipid A is a very dangerous component. This lipid A is nothing but called as your endotoxin. This lipid A is nothing but called as your endotoxin. You know, bacteria will release two different types of toxins. एक होगा exotoxin और दूसरा endotoxin, right? So this is a gram-negative bacteria which is releasing which toxin? It is releasing endotoxin. Keep that thing in mind. If I ask you what is endotoxin, endotoxin is lipid A. Where is lipid A present? Lipid A is present above the outer membrane of your gram-negative cell wall. I hope this is clear before I go to the functions of endotoxins. Everyone is clear till here? These things you will study in physiology, guys, okay? These things you'll study in physiology. Right. Got it? Everyone, all the 133 members. Guys, you're all here? Sorry, there is a small technical issue over here, right? So let me share my screen over here. I hope all of you can look at the screen right now. Right. So hope everything is clear to you right now. So I'm visible to you and you can even, am I audible also? Very good. Right. So this is what I was telling. Let us not miss the flow. Okay? Let us not miss the flow. So this is what I was telling you, that lipid A is the endotoxin. Now, what is endotoxin? What is exotoxin? Endotoxin kya hoga? What is endotoxin and what is exotoxin? All of you look here. Let us say that this is a one bacteria. Let us say this is another bacteria. Okay. There are two bacteria over here. Now, this bacteria is having its toxin within the body. I mean, within the cytoplasm, this bacteria is having a toxin. Okay. Now, look at another bacteria. This bacteria is having the toxin within the cell wall like this. Ye dekho, within the cell wall, there is a toxin. Let me open your chat box. Yeah. So within the cell wall, you have got the toxin of this bacteria. So you understood the difference. One is in the cytoplasm, another one is within the cell wall. Now, if let us say this is the blood vessel. Let us say this is the blood vessel. Now, if this bacteria want to release the toxin, where it will release? This bacteria will release the toxin directly into your blood vessel. Okay, such toxins are called as exotoxins. Exotoxins are the toxins which are releasing the toxin into the blood vessel is called exotoxin. Now, what is endotoxin? What is endotoxin is that whenever you are giving broad spectrum antibiotics, jante ho what is broad spectrum antibiotics? Broad spectrum antibiotics means these antibiotics can attack on wide variety group of bacteria. Okay, so there are two different types of antibiotics. Narrow spectrum, it means you are targeting few microorganisms. So those antibiotics are called narrow spectrum antibiotics. Broad spectrum means there are wide group of bacteria and you are giving a drug which will kill all of them. So whenever you are giving broad spectrum antibiotics, these antibiotics target is that these antibiotics, they go and destroy the cell wall. You see, what are they doing? They are going and destroying the cell wall. So once the cell wall is destroyed, what is happening? Bacteria will die. But on the other hand, what is happening? From the cell wall, the powerful toxins are released, and these toxins are nothing but called as endotoxins. Endotoxins. All of you understood this basic difference? Everyone, tell me. Everyone understood this basic difference? Just tell me yes, and remaining, raise the hand. Very good, Krishna Bharatwaj, you are right. Very good. Now what I want you to tell is that I want all of you I want all of you. Tushar, I will repeat that in a minute. I'm explaining that thing, the same thing in much more detail. You will understand it. Okay? I'm explaining that once again, you'll understand it. What I'm telling you is that, see, one bacteria is having endotoxins within the cytoplasm. Such bacteria releases, these toxins are called as what? Exotoxins. Exotoxins are released directly into the blood. Another group of bacteria, they are having endotoxins in the cell wall. Cell wall क्यों बोला? क्योंकि ये देखो ये पेप्टिडोग्लाइकन लेयर है ना, पेप्टिडोग्लाइकन लेयर के ऊपर above the peptidoglycan layer you have got lipopolysaccharide. Within that lipopolysaccharide, one component is called as lipid A, which is your endotoxin, right? Which means your endotoxin is present within the cell wall, right? Now, when I give antibiotics, what will happen is that antibiotics, they will damage the cell wall. They will cause lysis of cell wall. So whenever the cell wall is broken, bacteria will die. Bacteria will die. But before dying, what the bacteria will do? It will release the toxins from the cell wall. And these toxins are called as endotoxins. I hope you understood it. Now, all of you, what you do is that put your pens down, right? Put your pens down. Just watch, listen, whatever I'm telling you. This concept of endotoxins, function of endotoxins, you will come across in pathology. You will come across in medicine. You will come across in physiology also. In these three subjects, these concepts will be repeated. So listen carefully. Okay. Right. First important thing. Let us discuss about the functions now. Functions of endotoxins. Coming to the functions of endotoxins, the first important function. What is the first important function? Don't comment, just listen. Let us say this is the, right. Let us say this is the macrophage over here. ये क्या है? What is this? This is your macrophage. This is your macrophage. Now, on the surface of macrophage, you have got a receptor like this. Okay. What is the name of the receptor? This is called as TLR4. TLR4 matlab, see, don't comment. That's what I'm telling you. Don't comment. Just listen. Just watch the movie like this. Okay. TLR4 matlab toll-like receptor number 4. Toll-like receptor number 4. Okay. Clear? Right. First thing, what is happening? Whenever an endotoxin is released, this endotoxin will attach here. What is this? This is your endotoxin. Once endotoxin will attach here, what is happening is that this TL4 receptor gets activated. Okay. Once TLR4 receptor gets activated, you know the message is taken all the way down to the nucleus. So this is your nucleus. Okay. Now what will happen? The nucleus will get to know that endotoxin has come inside. Yes or no? Now the nucleus gets activated. Once the nucleus will get activated, it will tell this macrophage to release three important things. What are those three important things? What are those three important things? One is called as interleukin 1. What is this? IL-1. What is IL-1? Interleukin 1. Second is interleukin 6. Interleukin 1, interleukin 6. Okay. Next, it will also, after some time, it will cause the release of TNF alpha. TNF alpha matlab tumor necrosis factor alpha. Okay. All these are called as cytokines. So tumor necrosis factor alpha. और तीसरा क्या होगा? Nitric oxide. The third one will be nitric oxide. So what are the things that are released? Interleukin 1 and 6, TNF alpha, and nitric oxide. These are the three important things that are released by the macrophage. Now forget this story here. Okay. Now what will happen? Just concentrate here. What will happen is that all of you know that this is your blood vessel. This is your blood vessel. And tell me guys, lining your blood vessels, what is the epithelium you have got? This is called as your endothelium. Lining your blood vessels, you have got your endothelial cells. All of you know this from your physiology you have studied. Okay. Now what I'm doing is that I will just enlarge one endothelial cell. Here they go, this is blood vessel. Okay. And now what I'm doing, I'm just enlarging one endothelial cell like this. Okay. And see what is happening inside. Normally, what will happen inside is that within your each endothelial cell, there is an acid called arachidonic acid. What is the acid name? The acid name is arachidonic acid. Okay. This arachidonic acid is converted all the way. This arachidonic acid is converted all the way into prostaglandin. Prostaglandin. Now, there should be some enzyme here. Simply, it won't convert. There should be an enzyme. The name of the enzyme is cyclooxygenase. What is the name of the enzyme? Cyclooxygenase. But in your textbooks, in your pharmacology textbooks and all, it will be written as COX enzyme. Okay. Now, you should know what is the function of prostaglandin. Prostaglandin has got only two functions. What is the first function? What is the main function is that this prostaglandin, look here, this is your normal blood vessel. Once prostaglandin will fall on this blood vessel, the blood vessel will become like this. What has happened? What did happen here? Don't you think there is vasodilation? There is dilation of the vessel. So what has happened over here is that there is vasodilation. So what is the function of prostaglandin? Prostaglandin causes vasodilation. Now, second important thing, prostaglandin is also responsible for causing fever. Is also responsible for causing fever. Now, guys, you tell me this thing that if my blood vessel, this is my blood vessel is having a pressure of about 120 by 80 mm of mercury. Okay. Now, if this blood vessel will dilate, the blood pressure will fall down or the blood pressure will increase. What will happen to the blood pressure? Obviously, very good. The blood pressure will fall down, right? So when the blood pressure is falling down, can I tell that the patient is entering into hypotension? Yes or no? So because of this vasodilation, what is happening? Patient is entering into hypotension. Because of this vasodilation, patient is entering into where? Patient is entering into hypotension. So this is one of the very, very, very important thing you have to remember. Okay. Now listen carefully. What did I tell you? I told you that these macrophages will release interleukin-1 and interleukin-6. Now I'm telling you the function of interleukin-1 and interleukin-6. Not only that, even the function of TNF-alpha. Interleukin-1, interleukin-6, TNF-alpha, you know what they will do? They come all the way like this and they activate this COX enzyme, which is also called as cyclooxygenase enzyme. अगर ये cyclooxygenase enzyme को activate किया, if it activated, don't you think excess levels of prostaglandin are formed? If excess levels of prostaglandin are formed, don't you think the vessel will dilate more? If the vessel is dilating more, don't you think the patient's blood pressure is drastically falling down? Right? So normally if the blood pressure from 120 is falling down to 100 or 110, this is called hypotension. But if the blood pressure is falling from 120 to 70, all of a sudden, this is called shock. Okay. What is this called? This is called as shock. What kind of shock? This is called as hypotensive shock. Okay. This is called as hypotensive shock. Right. So what I was telling you, the first important, let us write down all the functions over here. The first important function over here is patient is going to have fever. Second important function, because of vasodilation, patient has got what? Hypotension. Hypotension. Severe form of hypotension is called what? Shock. I will write that thing later on. Now, one thing from pathology point of view, I'm telling you that you see this interleukin-1, you know, usually interleukin-1 is such a cytokine which is responsible for causing fever. You know, right now, if you have fever because of some viral or bacterial illness, jo bhi hai, if you have fever, that is because of interleukin-1. That is the reason why what you should do, you know, you should drink a lot of water. Whenever you have fever, you should be fully hydrated. पानी ज्यादा पीना चाहिए. The reason is that you drink more water, this interleukin-1 will be excreted out through urine. So when the interleukin-1 levels are falling down, right, obviously the temperature also reduces. That is the reason why during fever, when you have fever, you should drink excess amount of water. So that is one very important thing. Clear? So first function, all of you understood. First function, all of you understood here, everyone. right? Now, second important function is that it is also releasing another important thing called as nitric oxide. It is also releasing what? It is also releasing nitric oxide. All of you, if you have studied physiology, you know that nitric oxide is responsible for vasodilation. Very good. Muntazir, very good. So, third important function is nitric oxide is responsible for vasodilation. Vasodilation hua matlab what has happened? Again, hypotension in the patient. Again, hypotension will happen in the patient. Is everyone clear with this? Right. So now what do you know? The first function we are done. We are done with the first function. Macrophage. I will revise this later on, but till here, I hope all of you understood before I go on to the second function. Before I move on to the second function, all of you understood the first function. Safika, Kavya, very good. Muntazir, Tushar, you understood? All the 135 students understood over here. Everyone. Yeah, just comment. All of you comment here. All of you understood or not? Very good. Very good. Now let us go on to the second important function. What is the second important function is that you know that this is your liver. This is your liver, right? You also heard of mast cells, guys. You also heard of cells called as mast cells. जानते हो ना mast cells? What are these mast cells? You know, right? Mast cells are having what? Histamine. All of you know that, right? So let us say that this is your mast cell, right? Within the mast cell, there is histamine. Within the mast cell, there is histamine, right? Now listen here, very important thing. Very good, Akshay. It is responsible for type 1 hypersensitivity reaction. Very good. So normally what will happen is that when endotoxin is released, okay? When endotoxin is released, this endotoxin, what will it do? You know, this endotoxin will activate your liver. Now, once this endotoxin will activate your liver, from the liver, two important complement proteins are released. Okay? What are these things? These are called as complement proteins. So there are two important complement proteins are released. One is called C3A. Another one is called C5A. याद रखना ये बहुत important है. C3A and C5A are two complement proteins. Now what will happen? These complement proteins have got a sharp point like this. Okay? Now look what will happen. These complement proteins, they wander all the way in the blood and finally they will make holes within your mast cells. What are they making? They're digging the mast cells. They're making holes in the mast cells. So once there are multiple holes, ये देखो, once there are multiple holes within the mast cells, क्या होगा? What will happen when there are multiple holes within the mast cells? Don't you think all the histamine will be released outside? है ना? So क्या होगा? Histamine will be released. And tell me the function of histamine. Histamine has got two important functions. One is called as vasodilation. And the next one is called as edema. One is called as vasodilation and the second function is called as edema. अब तुम बताओ कि fourth important function, histamine की वजह, because of histamine, what has happened? Again, the patient is having vasodilation. Okay, because of vasodilation, what will happen? Again, hypotension. Again, patient is having hypotension. Fifth important function of histamine, what is that? It is even causing edema. Yes or no? Swelling all the way. Now, you tell me, guys, hypotension is because of how many components? Three components. One, because of macrophages, wo cytokines release hua, there is hypotension. Because of nitric oxide, there is hypotension. Because of histamine, there is hypotension. When such hypotension is happening because of three important things, don't you think patient right now is having very severe form of hypotension? Very severe form of hypotension, what did I tell you? It is nothing but called as shock. Or ye shock. Why did this shock happen? This shock has happened because of endotoxins. इसीलिए इसको एंडोटॉक्सिक शॉक बोलते हैं. ओके, दैट इज व्हाई यू कॉल दिस एज एंडोटॉक्सिक शॉक. That is why you call this shock as endotoxic shock. All of you understood the second function also. Before I go on to the last function, all of you understood this. Just raise your hands or message कर लो, कुछ भी कर लो, but मुझे बता दो कि you understood. All of you understood, right? Very good. Salim Ansari, very good, very good, very good, very good, very good. Anand Prakash is not in the class today. Tushar, very good. Fine. So, Vinay Verma is there. Nagesh Paila is also there. Right. The next important function. Look at the next important function over here. The last important function is that these endotoxins, what do they do is that, you know, if you have studied physiology, there you heard of tissue factor, some word called as tissue factor. You heard of a term called as tissue factor, right? You know what these endotoxins will do? These endotoxins will activate this tissue factor. And you know what is a function of a tissue factor? Tissue factor will convert prothrombin to thrombin. It would convert what? Prothrombin. I think you heard of these terms very well. Prothrombin to thrombin. And all of you tell me what is the function of thrombin? It would convert fibrinogen into fibrin. What is the function of thrombin? It is going to convert fibrinogen into fibrin. Okay. What will fibrin do? Fibrin will form clots. Wherever there are platelets, this fibrin will form like a network on that platelets and form a clot. Yes or no? Now you tell me that if endotoxins are high, if the endotoxin level is too much, then don't you think excess amount of tissue factor will be activated? If tissue factor is activated again and again, don't you think excess levels of fibrin is formed? If excess levels of fibrin is formed, don't you think that in your blood vessels, everywhere there will be blood clots? So everywhere, if there are blood clots within your blood vessels, can I call it as disseminated intravascular coagulation? Right? So this is called as disseminated intravascular coagulation. Okay. This is called as what? This is called as your disseminated intravascular coagulation, DIC. Very good. This is called as your DIC. Very good. So the sixth important thing is DIC. So if someone asks you what are the adverse effects or what are the actions of endotoxins, what will you tell? If someone asks you what are the functions of endotoxins, how many functions are there? There are 6 functions. One is called as fever. Fever is caused by what? Interleukin 1. Okay. Fever is caused by interleukin 1. Obviously, Ajoy, it would lead to hypertension, because if there are blocks within the vessels, it would lead to hypertension. It will also lead to infarction also. Okay. So first important thing is fever. Second important thing is vasodilation, that is hypotension. Third important thing, because of nitric oxide, again hypotension, right? Again, because of histamine, hypotension and edema. And the final function is disseminated intravascular coagulation. All of you understood whatever I have taught you now? Everyone? Right? Now, the MCQ points. We will also do MCQs today. Anyways, what are the MCQ points which you need to know is that endotoxins are released, listen carefully. Endotoxins are released only by gram-negative bacteria. Are there any exceptions? Yes. What is the exception? That 1 gram positive bacteria also releases endotoxin, and that is very good, Muntazir. That is Listeria. Okay. So write it down that endotoxins, so far we discussed, endotoxins are released only by gram only by gram-negative bacteria except Listeria, which is a gram-positive, also releases endotoxin. Okay. Second important thing. Second important thing is that exotoxins are released both by gram-positive and gram-negative, both of them. Exotoxins are secreted by gram-positive and gram-negative bacteria. Gram-positive as well as gram-negative bacteria. So before we go on to the questions, everyone, all the 139 students over here, all of you understood everything which I've taught. Everything. Jaldi batao. Be very fast. Very good. Just look here now. Let us go to question number 1. Okay. Let us go to question number 1. Now, these are the questions which were previously repeated. Okay. In the previous FMG exams, these were the questions which were repeated. So all of you just be cautious while you answer these questions. What are the functions of endotoxins? Tell me, what are the functions of endotoxins? See, first, inhibition of coagulation cascade. Inhibition or activation of coagulation cascade. Activation, hai na? So this is not a function. Vasoconstriction of blood vessels, no. Vasodilation of blood vessels. So this is not a function. Hypotension, yes. Shock, yes. Clear all of you? Hypotension as well as shock. Now, look at the second important thing. Look at the second important thing. You remember, guys, I told you that whenever you give broad spectrum antibiotics, right? Whenever you give broad spectrum antibiotics, what will happen is that, let us say I got fever. You don't know that I have gram-positive bacteria or gram-negative bacteria inside my body. I came to you. You know only one tablet that is gram-negative, that is a broad spectrum antibiotic. You have given me broad spectrum antibiotic. Then what happened? What happened is that I went back to the home, right? After taking the tablet. In the night time, I have very severe fever, very severe fever. What might be the reason? The reason might be that the tablet which you have given has affected the cell wall. Cell wall is broken down and endotoxins are released. So the fever, the blood pressure, everything, they dearranged. All of you understood this thing, right? Now let us do this question. 50-year-old patient with typhoid fever was treated with levomycetin. Okay. The next day, his condition became worse. Temperature raised to 39 degrees. 39 degrees you have studied, that is febrile, right? What caused this worsening? What will be the answer? Just type A, B, C, D, E. What will be the answer? Very good. The effect of the endotoxin agent. Effect of endotoxin agent. Very good. Sepsis and septicemia are usually caused by, obviously bacteria cause karega na, sepsis or septicemia. This is a simple question. Now tell me, endotoxin, which is also called lipopolysaccharide, is an important constituent of gram positive, gram negative, protozoa, fungi. A, B, C, D, E. Come on. Very good. Very good. Gram negative bacteria. It is an important component of what? Gram negative bacteria. Now tell me this thing, which cytokines play central role in the development of systemic inflammation and pathology? Kaun sa cytokines will play an important role here? We discussed how many cytokines? We discussed interleukin 1, we discussed interleukin 6, we discussed TNF alpha. Now see, what will be the answer? TNF alpha as well as interleukin 1. All of you understood? Right. Association of endotoxin in a gram-negative bacteria is due to the presence of what? Due to the presence of what? Tell me that endotoxin in the gram-negative bacteria is also called as one very important term. Very good. Answer nahi bataya abhi. Yeah, very good. Answer is 3, lipopolysaccharides. Not peptidoglycan. It is lipopolysaccharide only. Okay, this is what? Lipopolysaccharide. All of you understood? Everyone understood here? Before I move on to the next important topic, all of you understood this thing? Perfectly clear? Very good, very good, very good. Now, another important thing is encapsulated bacteria. Encapsulated bacteria matlab kya? What do you mean by encapsulated bacteria? Ajmeri Anas, I will revise everything in short. We should complete the syllabus also. Fatafat, है ना? So I will revise this before we end the class. Last 5 minutes I'll put just for revision and very fast I'll revise this. Okay? So when it comes to encapsulated bacteria in the sense bacteria which is having a capsule is called encapsulated. Bacteria which is not having a capsule is called unencapsulated or non-capsulated bacteria. Okay. So what did I tell you? What did I tell you? I told you one very important thing in the starting of the class. First lecture yesterday itself, I told you capsule has got only one function that is called as anti-phagocytic. It will not allow the phagocytes to come and attack the bacteria. Okay. So there are two important actions over here. What are these two important actions? What are these two important actions? One is called as it is anti-phagocytic, and second one, it performs a process called as opsonization. Now, this is another clinical point in microbiology, which you need to know right now. This part, whatever I'm telling you, will also come in your PSM. It will also come in your medicine, pathology, and pediatrics also. Okay. So just keep this thing in mind. What I'm telling you is that, let us say, for example, this is your blood vessel. Okay. This is your blood vessel. Okay. From your anatomy point of view, the artery which is supplying to your spleen, what is that artery? Splenic artery. All of you know that. Let us say this is your spleen. Now, within the spleen, you have got a macrophage like this. These are called as splenic macrophages. What are these macrophages called as? These are called as splenic macrophages. Now, what I'm telling you is that whenever a bacteria is entering into your body, let us say this is a bacteria that is entering into your body. And now I'm telling you that this particular bacteria is having a capsule around it. Okay. This bacteria is having what? You see, this bacteria is having a green color capsule around it. Now, such bacteria is called as an encapsulated bacteria. Whenever an encapsulated bacteria will enter into your body, what will happen is that within your body, there are some proteins called as opsonins. What are the name of the proteins? These proteins are called as opsonins. For example, all of you know IgG. All of you also know C3b. This is a complement protein, right? So what I'm telling you is IgG and C3b, these two are called as opsonins. Okay. What do they do? What do they do is that, see here. Here IgG is attached, and let us say here C3b is attached. Okay. Opsonins coating highlight. Yeah. So one is IgG that is attached and the other one is C3b. Okay, attach ho gaya. Now what is going to happen is that these opsonins will take this bacteria to the spleen. These opsonins will take the bacteria all the way like this to the spleen. Spleen ke paas leke aaya. Now what the splenic macrophages will do is that these splenic macrophages will destroy this bacteria. This is the normal process that is happening in you and me. Okay. Now, who is mediating this process? This process is mediated by opsonins. Agar opsonins nahi hota, if opsonins are not there, you cannot take the bacteria to the spleen. All of you understood till here? This happens in you and me. Now, what I'm telling you is a clinical point. What if I don't have spleen? Agar mere paas spleen nahi hai, if spleen is not there, let us say I met with an accident, okay, and my abdomen is enlarged. They have done an ultrasound and they found that there is excess amount of blood within my peritoneum. They later on also found that my spleen is ruptured. So kya karenge? Stitch karenge kya? No, they won't stitch. They will just remove your spleen. This is called a spleenectomy. So what will happen if spleen is not there? If spleen is not there, what will happen? These opsonins will bring the bacteria to the spleen, but there is no spleen. If there is no spleen, don't you think this bacteria, it is a positive sign for the bacteria? don't you think the bacteria will start attacking you? You know, the patients who does not have spleen, in those patients, there are 3 infections that are all the time common. Okay. What are those 3 infections are? They are called pin infections. P stands for pneumonia. What pneumonia? Klebsiella pneumonia. Klebsiella pneumonia. I stands for influenza. That is Haemophilus influenza. Haemophilus influenza. And N stands for Neisseria. That is Neisseria meningitis. Neisseria meningitis. Okay. Now, simple thing I'm telling you guys, I want you to remember at any cost these 3 infections, because these 3 infections are more common in asplenics. Asplenic patients, patients who don't have spleen. You know, if one day a patient comes to me telling that, doctor, few months back, I met with an accident, right? And there was a rupture of my spleen. Later on, when I went to the emergency department, they have taken me to the emergency department and they have done emergency surgery. Now, in this emergency surgery, they have removed my spleen. Now, it has been 2 months that I don't have my spleen. Now, he is afraid that what infections might attack him in the future. You have to tell 3 infections will attack: pneumonia, influenza, and meningitis. So he is really afraid that what should I do? What will you do? Will you give the treatment or will you give the vaccines to the patient? Obviously, you give vaccines for prevention. What vaccines will you give is an important question that is asked all the time in the exams. The first vaccine for pneumonia you give is pneumococcal vaccine. You give pneumococcal vaccine. Next, for Haemophilus influenza, what vaccine you give? Haemophilus influenza type B vaccine. Simply called it as HIB, Haemophilus influenza type B. And for Neisseria meningitis, what vaccine you give? Meningococcal vaccine type B. Meningococcal vaccine type B. So these are the 3 important vaccines which you give. Okay. Now, another important thing. Sir, pneumococcal vaccine is of how many types? There are 2 different types of pneumococcal vaccine. One is called as pneumococcal vaccine 13, PCV 13. Another one is called as PPSV 23. If you want to remember it like this, you remember it. If you want to know the full form also, that is also fine. PCV in the sense pneumococcal conjugate vaccine. I'm not writing it down here. I'll just repeat it. PCV 13 matlab pneumococcal conjugate vaccine. Okay. In the same way, PPSV 23 in the sense pneumococcal polysaccharide vaccine. Okay. Pneumococcal polysaccharide vaccine. That is PPSV. PCV in the sense pneumococcal conjugate vaccine. So all of you understood now? Everyone is perfectly clear with this? Now the question is, which bacteria are having capsule, which bacteria are not having capsule? Just remember this mnemonic. Please shine in school. So this was the mnemonic that I have taken from the first aid, the USMLE first aid. Okay. So what does P stand for? P stands for Pseudomonas aeruginosa. Pseudomonas aeruginosa. I think we have discussed about this Pseudomonas aeruginosa, if you remember, right? Second important one, S stands for what? S stands for Streptococcus pneumoniae. Streptococcus pneumoniae. Next, H stands for what? H and I. H and I together stands for Haemophilus influenza. I'm just writing it as H influenzae. Okay, Haemophilus influenza. Next, what does N stands for? N stands for Neisseria meningitis. Neisseria meningitis. After that, what does E stand for here? E stands for E. coli. E stands for here is E. coli. Okay. Right. Second important thing, what does S and K stands for? S stands for Salmonella. Salmonella. And K, you already know, Klebsiella pneumonia. Klebsiella pneumonia. Klebsiella pneumonia. So these are the bacteria which are having capsule. Other than this, jo bhi bacteria hai, it is not having capsule. Very easy, right? So these bacteria are called as encapsulated bacteria. Encapsulated bacteria. Okay. So till here, guys, till here, if you know, that is more than enough. More than enough for what? More than enough for your FMGE. Okay? But next exam में they are asking much more than this. What are those 2-3 points which you need to know is that they are going to ask you, all these are encapsulated bacteria, that is fine. But they are asking you, what is this capsule made up of? What is the important thing? What is this capsule made up of? You should know that this capsule is made up of polysaccharide. So all this bacteria over here, the capsule is made up of polysaccharide. So you call it as polysaccharide capsule. So this is one very, very important question. Okay. Now they are also asking one more question. Okay, there is only polysaccharide capsule or there are any other capsules? Yes, there are other capsules also. For example, hyaluronic acid capsule. Where is this hyaluronic acid capsule present? It is present in case of Streptococcus pyogenes. Streptococcus pyogenes. Sir, how to remember? All of you know happy, right? Happy is, you can also spell happy as happy, right? Happy. So what does H and Y? HYA, right? HYA will indicate hyaluronic, PY indicate pyogenes. Okay, remember that way. So HYA is your hyaluronic and alone P and Y is your pyogenes. Hyaluronic acid, that is, that type of capsule is present for pyogenes. Okay. Next important question is that nowadays they're also asking you that polypeptide capsule is present in. Polypeptide capsule. Don't confuse polysaccharide with polypeptide. All of Muntazir, perfect. Very good. Ajoy MD, very good. So you're right. Polypeptide capsule is present for Bacillus anthracis. Bacillus anthracis. Acha, ruko. Just wait a minute. We discussed Bacillus anthracis somewhere, है ना? We discussed Bacillus and Clostridium are the species which release spores. वहां पे discuss किया था. We discussed Bacillus anthracis will cause anthrax. Two places we discussed. You remember that? Right. Sir, how to remember this? You know what is father called in Hindi? Bab. Okay. What is B and A? B and A stands for Bacillus anthracis. What does P stand for? P stands for polypeptide capsule. Clear, all of you? The last capsule which you need to know over here, right? This capsule is present in an organism called Yersinia pestis. Yersinia pestis, right? Now, if you are first in a race, let us say if you have come first in a race, or let us say if you are first in any other competition or whatever it is, what are you going to tell? You will tell, yes, I am first, right? What is yes here? Yes stands for Yersinia. First, what are the first two letters in first? F1, right? So F1 protein capsule. F1 protein capsule. So these are the capsules which you basically need to know. Clear? Every one of you are clear with this? Perfectly clear? Yes or no? Jaldi bolo fatafat so that I'll go on to the next important thing. Yeah? Top? What happened? Anyone messaged? Hello? On the top, what happened on the top? Right. Now, let us, acha. Right. Let us do this question which was repeated previously. Okay. Let us do this question which was repeated previously. What was the question that was repeated was, ध्यान से देखो, listen, look at this question very carefully. 23-year-old male was involved, listen carefully again, 23-year-old male was involved in a motorcycle accident, is brought to the nearest level 1 trauma center. Okay. On the arrival, patient vitals are temperature is 37, heart rate is 102, blood pressure is 105. ये देखो, blood pressure is 105 in the sense you need to think in your mind that there might be bleeding, there might be blood loss. A fast examination is performed during the initial workup, which demonstrates significant, ये देखो, significant free fluid in the abdomen. Free, what is this thing here? Free fluid in the abdomen. Okay. An abdominal CT is subsequently obtained, which demonstrates grade 5 splenic laceration. Laceration means a cut in the spleen. Okay. Grade 5 is the maximum grade here. And the patient is emergently brought to the operating room where a splenectomy is successfully performed. Splenectomy is done. Following the surgery, the patient will be at an increased risk of which of the following organism? Batao. Patient will be at an increased risk of which organism? Everyone. What did I tell you? Patients who don't have spleen, they will have 3 infections. PIN. P stands for what? Klebsiella pneumonia. I stands for influenza, Haemophilus influenza, and N stands for Neisseria. So the answer would be 4. I don't think so. After learning with the concept, it is very difficult for you to retain the things, right? So if you revise these concepts again and again, I'm telling you, these subjects will be really very, very easy. Okay, don't think microbiology is a difficult subject. Even I agree that it is difficult. You need to remember a lot of things, but still, concept part is always interesting, whether it might be anatomy, whether it might be microbiology or whatever it is. Okay. How, okay, you told me, you have given me a very big lecture on capsule. You told me polysaccharide capsule, hyaluronic acid, polypeptide, F1 protein capsule. How will you identify a capsule? How will you identify, thank you Muntazir, how will you identify a capsule? Very important thing is that you cannot stain a capsule. Stain a capsule in the sense you cannot color a capsule. Okay. What I'm telling you is you take a slide like this. Okay. Add bacteria. See, I have added bacteria like this. I have added bacteria. Okay. Now in this, some bacteria are having capsule. Okay. Some bacteria are not having capsule. Some bacteria are having capsule. Some bacteria are not having capsule. Now what I will do is that I will add a ink. Okay. The name of the ink is Indian ink. Okay. When I add Indian ink, what will happen is that, what will happen is that the Indian ink is taken up by the background. Okay. Or else I'll tell you like this. First, Indian ink is taken up by the bacteria. Bacteria will take the Indian ink. Okay. It will absorb the Indian ink like this. So all the bacteria will look black in color, dark. Indian ink is also taken up by the background. Obviously, when you pour the ink in the plate, the entire background is coated. But have you seen here that the Indian ink did not enter into the capsule? Just look here. Look at this. Did the Indian ink enter into the capsule? No. Why? Because capsule cannot take the color. So such kind of coloring is called as negative staining. Right? You're not directly staining the capsule. Indirectly capsule ko stain kar rahe ho. This is called negative staining. Look at this picture. In this picture, what you can see here, whatever is black in color, this is bacteria or surrounding pura ye Indian ink hai. Bacteria ke andar bhi, within the center of the bacteria also you have got Indian ink, but surrounding the bacteria you see that white color thing, that is the capsule which is not stained. Okay. So if you see such picture anywhere in your life, straight away only one answer should come into your mind, that this is a capsular staining. Capsular staining. And this method of staining is called as negative ink stain. Negative ink stain. Negative ink stain. Now in this negative ink stain, we use basically 2 different types of inks. One ink is called as Indian ink. One is called as Indian ink. और दूसरा क्या होगा? Nigrosin. निग्रोसिन, इंडियन इंक एंड निग्रोसिन, इन दोनों में कौन सा चीप होगा बताओ, विच वन विल बी चीप? यू नो द आंसर ऑलरेडी, राइट? Which is the cheapest ink, which is the costliest ink? Cheapest is the most commonly used ink, obviously. So Indian ink is the cheapest ink. So this ink is cheap and this ink is best. Best कौन सा है, cheap कौन सा है? ये दोनों, these two are the questions which were asked. Cheapest ink is Indian ink, best ink is Nigrosen. Okay, right? Next important thing, sir, one method you told me this. Now I don't have ink. You are telling I don't have ink, I don't want to buy, even if it is cheap, I don't want to buy. Tell me another way. Another way, what you have to do is that take bacteria. Okay, bacteria liya. Now what you do is that there are bacteria here. Now take a glass. Okay, this glass is containing what? Serum. Serum contains what? Antibodies. What you do is that you add all the serum into that glass, okay, into the agar plate. Now what will happen is that if bacteria is having capsule, these antibodies will go attach to the capsule and cause swelling of the capsule. Again, I'm telling you, if bacteria is having a capsule, these antibodies will go attach to the capsule and cause swelling of the capsule. Agar bacteria ke surrounding, if there is no capsule, then the antibody also will not attach, right? So this reaction is called swelling reaction. Right? A slight modification of the name is quilling reaction. So this reaction is called as quilling reaction. Quilling, swelling, both of them, they are similar. All of you can look at this picture here. You see how the bacteria is in the center, surrounding how much the capsule has been swollen. But this one is not swollen. Why? Because this bacteria is unencapsulated. It is not having any capsule. Okay, so this reaction is called as quilling reaction. All of you understood everything which I've told you. In the next class, what we will discuss is that we will classify the organisms into different types. For example, based upon the catalase, based upon the urease, based upon hemolysis, and based upon the pigment. So this would be a lengthy topic which we will cover it for tomorrow's class. Okay. So till here, guys, all of you, serum, simple thing. See, this is a agar plate which I have taken. Okay. I have added bacteria here. Now in this, some bacteria are capsulated, some of the bacteria are not capsulated. Okay. What I will do, I will take a cup of serum. Serum contains what? Antibodies. I will add serum onto the agar plate. Now these antibodies, if there is a capsule, these antibodies will go attached to the capsule and pull the capsule. They will cause swelling of the capsule. That is why you can see the capsules are swollen here. Right? If there is no capsule, no swelling. Very simple. This reaction is called quilling reaction over here. All of you understood everything which I have taught you today. Be fast. Jaldi batao. Tell me very fastly. My focus is mainly on new students who are attending microbiology for the first time. Okay, microbiology for the first time, whoever is attending, are you all understanding? There are 128 students here. All of you are understanding everything, or you want me to tomorrow also the same timing only, or you want me to change anything? If you are new students, just type here as I'm a new student, I'm understanding, or I'm a new student, I'm not at all understanding, or I'm a new student, which subject is this? Kuch bhi, है ना? Right. Very good. Thank you, Amrita. Thank you, Umar Khan. But thank you, but Ravina Patel. Thank you so much. Salim Ansari, Vinay Kumar. Very good. So fine, guys. This is all for today. Tomorrow we will extend little bit. Okay, we'll extend little bit and continue the further class. So for today, this is all. And from tomorrow we will extend it till 7:30. Okay, we'll have the classes. If you come on the time, if you come on the time at 6 o'clock, right? From 6, we will take the class till 7:30 and we'll finish it off. क्योंकि आप लोगों को you even have to go to mess, right? Have the food and all. Right. So, chalo, take care, goodbye, and I'll post this in the Telegram group. So, till then, take care, goodbye, and love you all. I'll soon come, don't worry. Bye bye.